Welcome to EMTprep Pulse Check, the podcast where we help you sharpen your knowledge, ace your exams, and stay field ready. Whether you're prepping for the NREMT or looking to stay sharp in the ever-evolving world of EMS, we've got you covered. Each episode brings educational insights, real-world case reviews, and expert tips to boost your confidence, both in the classroom and on the call. Let's jump in. Today we'll be covering 50 EMT-Basic questions covering the following focus areas: medical and OB/GYN, cardiology and resuscitation, trauma, EMS operations, and airway and breathing.
Hello and welcome. Today we are going to go through a 50-question quiz that covers all 5 of our current focus areas. This includes airway, respiration, and ventilation, cardiology and resuscitation, medical and OB/GYN, trauma, and EMS operations. We're going to start off with some airway, respiration, and ventilation questions. Our first question is: you arrive on a secured scene where the patient appears cyanotic with a reduced respiratory rate. Based on your assessment, you decide the patient is headed toward respiratory failure. Your next steps should include A. Administering oxygen to the patient and transporting rapidly. B. Calling for ALS backup to provide a definitive airway. C. Obtaining vitals and transporting rapidly. Or D. Having your partner apply an AED while you initiate chest compressions. I'll give you a few seconds to think about the answer. The correct answer here would be A, administering oxygen to the patient and transporting immediately. The important thing to remember here is that respiratory failure is the reduction of breathing to the point where oxygen intake is insufficient to support life, which is different from respiratory arrest, which is when the patient stops breathing altogether. In the case of respiratory failure, the patient needs a higher concentration of oxygen to help elevate their O2 levels, and it's really important to not wait for ALS to treat this patient. Provide oxygen and transport as quickly as possible. Question number 2. Which of the following joins the pharynx with the trachea? A, the hyoid bone, B, the esophagus, C, the vallecula, or D, the larynx? I'll give you a few seconds to think about the answer. The correct answer here would be D. The larynx is a complex structure that joins the pharynx with the trachea. So we know that we have 3 portions of the pharynx, but then we get down to the larynx, and that's that connection point between those 3 portions of the pharynx and the trachea. Question number 3. You are preparing to insert an oropharyngeal airway in a 32-year-old male patient. A contraindication for the use of this airway would be A, a patient whose tongue is obstructing their airway. B, a conscious patient with an intact gag reflex. C, a conscious patient with no gag reflex. Or D, facial trauma. The correct answer here would be B, a conscious patient with an intact gag reflex. We know that when using an oropharyngeal airway, or an OPA, that a conscious patient with an intact gag reflex would not be able to tolerate this type of airway. So you need to use an alternative airway like an NPA or a nasopharyngeal airway, or find another way to manage this patient's airway. Question number 4. You are called to the scene of a local lake after a cliff diving accident. Bystanders report your 26-year-old female patient stumbled while attempting a 40-foot jump off a rock and landed on her head in the muddy surface below. Which technique should be used to assess your patient's airway? A, tilt the patient's head and lift her chin. B, using both hands, thrust the patient's jaw forward and tilt her head back. C, tilt the patient's head back. Or D, use both hands and thrust the patient's jaw forward. The correct answer here would be D. use both hands and thrust the patient's jaw forward. It's really important to remember that because of the mechanism of injury here, you should suspect a possible cervical spine injury. In the case of this type of injury, the patient's head should not be tilted at all. Forward movement of the jaw should be used instead. Question number 5. You are dispatched to an 18-year-old male experiencing respiratory distress. When you arrive, he is sitting on the bench in the tripod position. He was playing basketball during the onset of his symptoms and has no history of respiratory problems or known allergies. His pulse is 105, respirations are 30, and they're shallow with wheezing. He's pale, cool, and dry. His vitals are steadily trending downwards. Which of the following is your first priority? A. Administer 100% oxygen and call medical direction for permission to administer inhaler. B. Withhold oxygen temporarily to avoid carbonic-driven respiration and transport immediately. C. Administer 100% oxygen and transport code 3. Or D. Administer 100% oxygen and transport code 1, coaching the patient to slow his breathing. The correct answer here would be C. Administer 100% oxygen and transport code 3. The key here to remember is that rapid shallow respirations with wheezing do indicate bronchoconstriction. So if this patient has a metered dose inhaler of albuterol, you could assist with its use, but there's no indication that this patient has any history of respiratory problems. So we really need to focus on that code 3 transport. Question number 6. After your paramedic partner has intubated an adult cardiac arrest patient, you provide ventilation while a firefighter performs chest compressions. When ventilating the patient, you should do what? A. Deliver each breath over 1 second at a rate of 10 to 12 breaths per minute. B. Deliver each breath over 2 seconds at a rate of 12 to 15 breaths per minute. C. Hyperventilate the patient to maximize carbon dioxide elimination. Or D. Deliver 2 breaths during a brief pause of chest compressions. The correct answer here is A. Deliver each breath over 1 second at a rate of 10 to 12 breaths per minute. When there's an advanced airway in place, you don't need to pause chest compressions to deliver breaths. You continue delivering breaths at this consistent rate of 1 breath every 5 to 6 seconds, which equates to about 10 to 12 breaths per minute. Question number 7. Snoring respirations in an unresponsive patient are most likely the result of A. Tracheal cartilage failure. B. Upper airway obstruction by the tongue. C. Edema surrounding the airway. Or D. Foreign body airway obstruction. The correct answer here would be B. Upper airway obstruction by the tongue. In this sort of case, the tongue is a common source of airway obstruction, and this is where an OPA can be used to alleviate the tongue that's causing the obstruction. Question number 8. Stridor is a high-pitched sound indicating an obstruction in which of the following? A. The bowel. B. The esophagus. C. The lower airway. Or D. The upper airway. The correct answer here would be D. The upper airway. Stridor refers to the sound made during an upper airway obstruction. We might hear it during things like epiglottitis, where there's swelling in the upper airway, or if an object is lodged in the upper airway. Question number 9. A 29-year-old male has overdosed on oxycodone and is unconscious with slow, shallow breaths. As you attempt to insert an OPA, he gags. Your next course of action is to A. Section the patient's oropharynx as you insert an NPA. B, remove the OPA and insert an NPA. C, place the patient in a recovery position and suction his airway. Or D, ensure it was the proper sized OPA and reinsert. The correct answer here would be B, remove the OPA and insert an NPA. If an OPA insertion produces a gag reflex, you need to try an NPA. In this case, suctioning the patient's mouth and throat would not be indicated. Question number 10. Exhalation is a blank process causing a blank pressure in the thoracic cavity. A, active and positive, meaning exhalation is an active process causing a positive pressure in the thoracic cavity. B, active and negative, so exhalation is an active process causing a negative pressure in the thoracic cavity. C, passive and positive. Exhalation is a passive process causing a positive pressure in the thoracic cavity. Or D, passive and negative. Exhalation is a passive process causing a negative pressure in the thoracic cavity. The correct answer here is C. Exhalation is a passive process causing a positive pressure in the thoracic cavity. Exhalation results from the relaxation of the diaphragm, making it a passive process. And as that diaphragm relaxes, the volume of space inside the thoracic cavity decreases, which causes positive pressure in the thoracic cavity, causing air to exit the lungs. We're now going to move on to cardiology. So question number 11. Blood flows into systemic circulation from which chamber of the heart? A, the left ventricle. B, the right ventricle. C, the left atria. Or D, the right atria. The correct answer here is A, the left ventricle. After blood receives oxygen from the lungs, the left atria receives that oxygenated blood and passes it to the left ventricle, which then pumps it into systemic circulation. Question number 12. Your patient is in cardiac arrest. You note that the rhythm on the monitor is wide, regular, and fast. This best describes which of the following rhythms? A, torsade de pointe. B, ventricular tachycardia. C, idioventricular rhythm. Or D, ventricular fibrillation. The correct answer here would be B, ventricular tachycardia. If the ventricles are beating too fast, so that's typically over 150 beats per minute, this is known as ventricular tachycardia or VTAC. It causes the QRS complex to become very wide but regular. The patient may or may not have a pulse. In the case of cardiac arrest, they will not. Question number 13. Of the following, which is the most serious physical manifestation of anaphylaxis? A, wheezing. B, urticaria. C, hypotension. Or D, pruritus. The correct answer here would be C, hypotension. Low blood pressure is more serious than hives, wheezing, or itching. If the patient's airway has become so swollen that it's obstructed, it would then become the most serious finding. Question number 14. Diastolic blood pressure represents which of the following characteristics of the vascular system? A, the pressure within the vessels during rest. B, atherosclerotic plaque buildup in the vascular system. C, the volume of fluid ejected from the heart with each contraction. Or D, the pressure within the vessels during contraction. The correct answer here is A. Diastolic pressure represents the pressure within the vessels during rest. It's that bottom number on a blood pressure reading, and it's kind of the force of the blood against the walls of the vessels, specifically the arteries, when the ventricles are relaxed. Question number 15. The most common cause of cardiac arrest in an infant is A. Airway obstruction, B. Accidental overdose, C. Trauma, or D. Respiratory arrest. The correct answer here would be D. Respiratory arrest. All of these can lead to cardiac arrest. Most of them lead to cardiac arrest by way of respiratory arrest. Some sort of airway obstruction or a problem with the child breathing is the most common cause of cardiac arrest in an infant. Question number 16. You are called to the scene of an amusement park. As you approach the scene, you witness a man grab his chest and collapse. Your patient is a 72-year-old male who has no pulse and is not breathing. After confirming cardiac arrest, you begin CPR. Your partner should do what? A. Ask bystanders about the events leading up to the arrest. B. Turn on the AED and follow the instructions for use. C. Perform a rapid head-to-toe examination. Or D. Perform a head tilt chin lift maneuver and provide positive pressure ventilations with high flow O2. The correct answer here would be B. Turn on the AED and follow the instructions for use. It is essential to apply the AED as soon as possible in order to increase the chance it will successfully resuscitate the patient. After the AED is applied and a shock is delivered, if indicated, you can then manage the patient's airway. Question 17. In pulmonary circulation, blank carry oxygenated blood from the lungs to the heart, and blank carry deoxygenated blood from the heart to the lungs. A. Capillaries and arterioles, which would read, in pulmonary circulation, capillaries carry oxygenated blood from the lungs to the heart, and arterioles carry deoxygenated blood from the heart to the lungs. B. Venules and capillaries, which would read, in pulmonary circulation, venules carry oxygenated blood from the lungs to the heart, and capillaries carry deoxygenated blood from the heart to the lungs. C. Veins and arteries, which would read, in pulmonary circulation, veins carry oxygenated blood from the lungs to the heart, and arteries carry deoxygenated blood from the heart to the lungs. Or D. Arteries and veins, which would read, in pulmonary circulation, arteries carry oxygenated blood from the lungs to the heart, and veins carry deoxygenated blood from the heart to the lungs. The correct answer here would be C. In pulmonary circulation, veins carry oxygenated blood from the lungs to the heart, and arteries carry deoxygenated blood from the heart to the lungs. Pulmonary circulation is the opposite of systemic circulation. In pulmonary circulation, veins carry oxygenated blood from the lungs to the heart, and arteries carry deoxygenated blood from the heart to the lungs. A way to remember this is that arteries always carry blood away from the heart. In most cases, this is oxygenated blood, but in pulmonary circulation, it is deoxygenated blood. However, it's always away from the heart with arteries. Question number 18. Upon arrival to a patient in cardiac arrest, which of the following should you do first? A. Administer oxygen. B. Ready an available automatic compression device. C. Insert an airway adjunct. Or D. Start CPR. The correct answer here is D. Start CPR. After assessing the patient's circulation and finding that they are pulseless, because in cardiac arrest we go CAB, so circulations, airway, breathing, we immediately need to begin compressions. So use an automatic compression device when appropriate, but we don't want to delay that initial compression while setting it up. Question number 19. The right atrium is responsible for which of the following? A, receiving blood from the lungs. B, pumping blood to the lungs. C, pumping blood to the body. Or D, receiving blood from the veins of the body. The correct answer here would be D. The right atrium is responsible for receiving blood from the veins of the body. The right atrium receives this blood via the superior and inferior vena cava and then sends it to the right ventricle, where it's sent off to the lungs to become oxygenated. Question number 20. What changes when doing CPR on a patient who is pregnant? A, the compression rate should be faster to account for both victims. B, nothing. C, compression hand placement should be higher on the breastbone. Or D, the compression depth. The correct answer here is B, nothing. Nothing changes when doing CPR on a patient who is pregnant. The survivability of the mother and child depend on adequate perfusion, which can only be achieved by proper hand placement, adequate depth, and a rate of 100 to 120 compressions per minute. We are now going to move on to our medical and OBGYN section. Question 21. Which of the following would indicate a mild to moderate allergic reaction? A, itching and hives. B, difficulty breathing. C, cyanosis around the mouth. Or D, shortness of breath or wheezing. The correct answer here is A, itching and hives. Any airway compromise or indications of hypoxia indicate a much more serious or severe reaction, like anaphylaxis. So itching and hives would be the most appropriate answer for a mild to moderate allergic reaction. Question 22. A decrease in heart rate and an increase in digestion are examples of a blank response. A, enteric nervous system. B, parasympathetic nervous system. C, sympathetic nervous system. Or D, somatic nervous system. The correct answer is B, parasympathetic nervous system. The parasympathetic nervous system is our rest and digest. So a decrease in heart rate and an increase in digestion are classic indications of an increase in the parasympathetic nervous system. Question 23. When tissue damage has occurred, fluid usually moves in which direction during the inflammatory response? A, outside of the body. B, towards the heart. C, from outside to inside the blood vessels. Or D, from inside to outside the blood vessels. The correct answer here is D, from inside to outside the blood vessels. When tissue damage occurs, the body's natural response is inflammation. In inflammation, the capillaries of the body allow water and other fluids to flow out into the spaces between the capillaries. This is called the interstitial space. This is what causes swelling that you'll see after an injury. Question number 24. When treating a patient with hepatitis, it's especially important to A, wear a HEPA mask only. B, warn bystanders that the patient has the disease. C, ensure that no direct contact is made with the patient's blood or other fluids without adequate PPE. Or D, have the patient wear a surgical mask to prevent the spread of droplets. The correct answer here is C. Ensure that no direct contact is made with the patient's blood or other bodily fluids without adequate PPE. Hepatitis is communicable through some bodily fluids, so avoiding contact with the patient's fluids becomes especially important. A mask is not necessary because it's not an airborne pathogen, and for privacy and legal purposes, you should never tell bystanders about the disease or a condition of the patient. Question number 25. You are delivering a baby in the field. As the baby's head comes out, it is facing downward. You should A. Gently twist the baby so that it is face up. B. Continue the delivery as normal. C. Suction the mouth and nose as this child will likely have an obstructed airway. Or D. Provide positive pressure to the baby's head and instruct the mother not to push. Transport to the hospital immediately. The correct answer here is B. Continue the delivery as normal. Most babies come out facing downward, so this is normal and you should continue the delivery as normal. Suctioning the mouth and nose is actually no longer recommended unless there's obvious signs of an obstruction from something like meconium to the airway. Question number 26. Which of the following is not a function of the skin? A. To provide a physical barrier. B. Regulating body temperature. C. Protecting against excessive water loss. Or D. The production of vitamin C. The correct answer here is D. The skin is not involved in the production of vitamin C. There are three main functions of the skin, which are to provide a barrier from outside infection, regulate temperature, and retain fluid. While the skin is involved in the production of vitamin D and does contain a high concentration of vitamin C, it's not directly involved in the production of vitamin C specifically. Question number 27. The trachea is where in relation to the esophagus? A. Anterior. B. Lateral. C. Posterior. Or D. Medial. The correct answer here is A. Anterior. This is a good opportunity for us to practice some medical terminology. A. Anterior, or in front of, is the correct answer because the trachea lies in front of the esophagus when the patient is in an anatomical position. Question number 28. The thorax is separated from the abdomen by which structure? A. The sternum. B. The diaphragm. C. The liver. Or D. The umbilicus. The correct answer here is B. The diaphragm. The diaphragm is a thin muscle that separates the organs of the thorax from the organs of the abdomen. It's a huge player in ventilation. As it contracts and relaxes, it changes the pressure within the thoracic cavity, drawing air in or forcing air out of the lungs. Question number 29. A complete breech presentation is when the baby is in which position? A. The shoulders present first with the hips flexed and the knees extended. B. The buttocks presents first with the legs extended and folded flat against the head. C. The buttocks presents first with the knees and hips flexed. Or D. A foot or arm present first with the other limbs folded against the body. The correct answer here is C. The buttocks presents first with the knees and hips flexed. This is considered complete breech and it's an OB emergency. The patient should be rapidly transported to the nearest capable facility. Question number 30. Insulin increases the cellular uptake of which molecule from the bloodstream? A. Glucose. B. Water. C. Carbon dioxide. Or D. Oxygen. The correct answer here is A. Glucose. Insulin, which is a hormone produced by the pancreas, is primarily responsible for the cellular uptake of glucose or sugar into the cells. We are now going to move on to EMS operations. Question 31. The physical or emotional exhaustion which occurs as a result of chronic stress from working is often referred to as A. Anxiety, B. PTSD, C. Depression, or D. Burnout. The correct answer here is D. Burnout. Burnout is defined as the exhaustion of physical or emotional strength. In the field of EMS, it typically stems from high call volume or particularly stressful calls that may not be properly processed. However, burnout can also be the result of a lack of adequate sleep, poor physical health, strained interpersonal relationships, and it's often exacerbated by unrealistic standards for personal performance, high levels of responsibility, and even life safety concerns. Question 32. When lifting a patient with several other rescuers, the medical personnel who coordinates the lifting should be A. Positioned at the patient's feet, B. Positioned at the patient's head, C. The person who first arrived on scene, or D. The person with the highest level of medical training. The correct answer here is B. The individual positioned at the patient's head. It's essential that all rescuers lift together when moving a patient. So the person who's going to coordinate that lifting should be positioned at the patient's head. They have a good view of the entirety of the patient. Question 33. You arrive at a local church to treat several cases of nausea, lightheadedness, and weakness from both the community and staff members. These symptoms range from minor in the young and middle-aged patients to more moderate in the elderly patients. All had about the same time of onset. Your primary concern is A. Checking the scene for a potential hazmat concern, B. Assessing respiratory status of patients, starting with those experiencing the most severe symptoms, C. Immediately beginning triaging the patients, or D. Obtaining baseline vitals immediately so you can track any changes in your patients. The correct answer here is A. Checking the scene for a potential hazmat concern. When there are multiple victims and no apparent cause, you have to think hazmat. There's likely a root cause of the common symptoms somewhere on the scene. Your safety and the safety of your crew always come first before treating any patient. So you need to make the scene safe and then begin treatment. Question 34. You're the triage officer at a large industrial accident with multiple injuries and casualties. You encounter an adult female patient lying on the ground. You detect a faint carotid pulse, but the patient is not breathing. You attempt to reposition her airway, but the patient remains apneic. How should this patient be triaged? A. Green, B. Red, C. Black, or D. Yellow. The correct answer here is C. Black. The patient is unable to breathe and attempts to open her airway are not successful. Under normal scene conditions, you would have to attempt resuscitation, but during this large incident, the patient will be classified as black. Question 35. Who takes command first at an emergency scene? A. The incident commander, B. Law enforcement, C. Dispatch, or D. The first arriving emergency worker. This one's tricky. The correct answer here is D, the first arriving emergency worker. You might think the answer was A, incident commander, and in a way, the first arriving person does become the incident commander for a brief period of time, but typically the incident commander refers to the person who oversees the scene throughout its entirety. In any emergency scene, truly the first arriving unit has command initially. So to answer this question successfully, who takes command first at an emergency scene? That would be the first arriving emergency worker. Question number 36. You are treating a 29-year-old female who is adamantly refusing transport. She is conscious, alert, and oriented appropriately. However, there are no witnesses available to sign the patient refusal form. How should you proceed? A. Insist that she must go to the hospital for evaluation without a witness signature. B. Have the patient sign the refusal form without a witness signature. C. Have her call someone who can come over to be a witness. Or D. Do not use the patient refusal form, but be sure to document thoroughly why it wasn't used. The correct answer here would be B. Have the patient sign the refusal form without a witness signature. This patient is conscious, alert, and oriented, therefore able to care for themselves and make their own decisions. So, although an extra layer of legal protection is helpful, the witness signature on a refusal form isn't necessary for the patient to refuse services. Question number 37. Which statement is true regarding a DNR order? A written DNR gives you permission to not attempt resuscitation on a patient. B, the expiration date of a DNR is always when the patient dies. C, a DNR only includes the signatures of the patient and the patient's legal representative. Or D, you must always contact medical control to confirm a DNR order while on scene. The correct answer would be A. A written DNR gives you permission to not attempt resuscitation on a patient. So a written DNR, or a do not resuscitate form, must be presented to you on scene for you to have permission to not resuscitate, and there would be no need to contact medical control. In some cases, it's important to know that DNRs contain an expiration date and must be dated within 12 months to be valid. So it's not always true that they expire only when a patient dies. A DNR will always include a physician's signature to be valid. Question 38. While responding to a reported domestic abuse call, you note a male running from the scene who appears to match the suspect's description. What should you do? A. Chase the suspect down on foot. B. Head straight to the scene now that the suspect has fled. C. Notify dispatch of what you've seen and the location so they can notify the police. Or D. Follow the suspect in your ambulance. The correct answer here is C. Notify dispatch of what you've seen and their location so you can notify the police. So it's important to let dispatch know what you've seen so they can notify the police, and then the police can decide whether or not to act based on their own knowledge of the situation. We would never chase down a suspect on our own or assume a scene is safe just because somebody matching the description of the suspect is seen fleeing from the scene. Question 39. Which of the following is an example of a pertinent negative? A negative finding on a lab report. B, a patient describing a symptom that has nothing to do with their chief complaint. C, a patient who is declining fast. Or D, a patient who is experiencing the absence of a specific symptom associated with their chief complaint. The correct answer here would be D, a patient who is experiencing the absence of a specific symptom associated with their chief complaint. Identifying a pertinent or relevant negative finding during your assessment will help you narrow down what is really going on. For example, a patient who complains of abdominal pain that doesn't have nausea or vomiting or fever is experiencing the absence of symptoms, which are equally important to report to the receiving facility. Question number 40. Which of the following methods is inappropriate for transporting a restrained patient? A, sitting with the hands handcuffed behind the back. B, prone with hands handcuffed behind the back. C, one arm secured to the top of the gurney and one arm secured to the side of the gurney, legs secured to the bottom of the gurney. Or D, arms and legs secured to a backboard? The correct answer here is B, prone with hands handcuffed behind the back. Placing a patient prone will result in difficulty breathing and possible apnea. We do not ever transport a patient prone for any reason. We are now moving on to our trauma section. Question 41. Your patient was involved in a house fire that caused severe burns on his body. His skin looks moist with several blisters along his arms and legs, and he is in severe pain. What degree of burn or classification of burn is your patient experiencing? A, superficial, B, partial thickness, C, full thickness, or D, deep thickness? The correct answer here is B, partial thickness. Second degree or partial thickness burns damage the epidermis and dermis, but don't cause damage to the underlying nervous tissue, which makes them incredibly painful. It's also important to note that blisters are often associated with partial thickness or these second degree burns. Question 42. The body will compensate for blood loss in all of the following ways except A, decreased heart rate, B, increased contraction of the heart, C, constriction of the blood vessels, or D, the release of epinephrine. The correct answer here is A, decreased heart rate. The body compensates for blood loss by constricting blood vessels to maintain blood pressure and increase the output of the heart to maintain blood pressure, especially getting blood to those vital organs. It'll also increase the output of the heart by increasing rate and contractile strength of the heart. Part of the mechanism behind these physiological changes is the body's natural release of epinephrine. The blood vessels will not dilate, especially initially. They will contract to compensate for that blood loss. Question 43. You are called to a local pond where a 23-year-old female has fallen through the ice while fishing. On arrival, she is lying on the pond's bank, and her boyfriend tells you he pulled her out and drug her over as quickly as he could. After ensuring the scene is safe, your very first priority is to A, perform a rapid trauma assessment, B, administer oxygen, take vitals, and provide rapid transport, C, take the patient inside the ambulance and remove all wet clothing, or D, wrap her up in warm blankets and administer oxygen. The correct answer here is C, take the patient inside the ambulance and remove all wet clothing. The priority on these scenes is always to remove the patient from the cold environment and remove all wet clothing. Then we can begin drawing and assessing the patient further. Question 44. The term for a traumatic injury that is characterized by an object breaking the skin and entering the body is A, a penetrating injury, B, shock injury, C, a blunt injury, or D, a high velocity injury. The correct answer here is A, a penetrating injury. Penetrating injuries refer to an injury that penetrates the skin or breaks that barrier. Blunt force trauma by nature does not break the skin or enter the body. Question 45. A 34-year-old female has fallen on her outstretched hand, resulting in pain and deformity to her elbow. Which pulse point would be the most appropriate to assess distal to the injury? A, ulnar, B, radial, C, pedal, or D, brachial? The correct answer here would be B, radial. If you are assessing a pulse distal to the injury, which means further away from the point of reference, you would need to understand that the radial pulse would be distal to the elbow or further away from the elbow when in anatomical position. As EMTs, you wouldn't necessarily assess an ulnar pulse, and the brachial pulse would be proximal to the injury. Question 46. When assessing a patient with a possible spinal injury, you should A. Apply a C-collar, B. Immobilize them on a backboard, administer high-flow oxygen right away, or D. Assess the patient in the position found. The correct answer here is D. Assess the patient in the position found. This question is specifically asking about assessing a patient with a possible spinal injury. So, you need to do a quick assessment in the position you found them and be aware that any unnecessary movement could potentially cause additional injury. So, you need to see where they do have sensation, pulse, and the ability to move their limbs before any intervention is given. Question 47. You are called to the scene of an assault at a private residence. Your patient is a 38-year-old male who has been stabbed in the chest multiple times. As you approach, you notice his breathing is labored, and you hear a sucking sound coming from his chest when you begin speaking to him. ALS backup is en route. How will you treat the chest wound? A. Suction the wound. B. Use an occlusive dressing over the chest wound. C. Use a dry sterile bandage over the chest wound. Or D. Leave the wound untouched so that air can escape. The correct answer here is that the best course of action would be to place an occlusive dressing over the chest wound if you have one. In this case, this is a dressing that seals the wound on 3 sides, allowing air to escape but not enter. The mechanism of injury here and the patient's labored breathing, and then of course the sucking sound coming from the chest, should really raise your index of suspicion that this person has a sucking chest wound. The hole through the chest means air can enter the pleural space and eventually collapse the lungs, causing a tension pneumothorax. So the occlusive dressing is placed in an effort to limit the amount of air that can enter the wound. Question 48. Cushing's triad signs and symptoms are associated with which type of trauma? A. Abdominal, B. Lungs, C. Head, or D. Heart. The correct answer here is C. Head. Cushing's triad is caused by head trauma leading to increased ICP or intracranial pressure. The triad, or 3 symptoms associated, are bradycardia, so slowed heart rate, irregular respirations, and a widening pulse pressure. Question 49. You are treating a 23-year-old male who has been impaled by a 1-inch diameter branch. The patient's shirt is saturated with blood. How should you proceed? A. Expose the area, control bleeding, stabilize the object in place with bulky gauze. B. Expose the area and remove the object if it interferes with the patient lying supine on the bed, otherwise leave it in place. C. Transport while manually securing the object. Or D. Remove the object and cover with gauze to control bleeding. The correct answer here is A. Expose the area, control bleeding, and stabilize the object in place with bulky gauze. When an object is impaled, you have to make every effort to keep it in place and minimize your manipulation of that object. So unless there's a life-threatening priority to remove it, like you need to perform chest compressions or address the airway, use a bulky dressing to secure it in place and transport. The patient does not need to be transported supine unless there is spinal compromise. Question number 50. The appropriate management of a chemical burn to the eye includes all of the following except A. Contacting poison control, B. Irrigating the affected eye from the medial to lateral aspect, C, removing the contact lenses, or D, irrigating the eye for a maximum of 15 minutes without stopping to reassess. The correct answer is D. It's important to irrigate the eye, and you can continue that during transport. However, there's not a 15-minute maximum, and you would definitely want to stop to reassess. In fact, reassessment should be ongoing. The reason the eye is irrigated from the medial to the lateral aspect is to avoid flushing the chemical into the unaffected eye.
Thanks for tuning in to EMTprep Pulse Check. If you found today's episode helpful, be sure to subscribe, leave a review, and share it with your classmates and crew. For more test prep tools, study guides, and practice exams, head over to emtprep.com. Until next time, stay sharp, stay safe, and stay on pulse.